Hi, I'm Dr. Hensel.
And I'm Dr. Craner. We're the founders of Active Edge Chiropractic and Functional Medicine. When I was a freshman in high school, I had this awful back pain. I could barely bend over, felt like an 80-year-old woman. I was running, dancing, and playing volleyball at the same time, and I really couldn't do any of them well. Till I learned a little bit more about my body, dug in a little bit more to movement and how movements in one end of your body affect movements in the other end of your body. And I was able to transition from having to rely on my chiropractic adjustments from that traditional perspective to being able to use that as a resource when I needed it to tune up and refresh. We knew that we did not want to be part of a traditional practice where it was just really adjustment centered and adjustment, see you later, crack, crack, see you later, kind of that stereotype that chiropractors tend to have. We knew that it was going to be really important for us to look at that whole picture and connect those dots for people as we were working with them to be able to get them to where they really wanted to be, to where they weren't going to have to rely on us, to where they could use us as a resource.
We see a very wide range of patients in the office, anywhere from newborn babies, a day or two old, all the way up to 90-some years old. Everyday, desk job person suffering from low back pain, headaches, neck issues, to the person wanting to run their first 5K, or the very, very high level triathlete trying to train 50, 60 hours a week.
The fun of the way we do things in here is looking at each person as an individual and considering all the injuries and the stressors and the things that you have in your past that have gotten you to where you are, because it's knowing those things that actually allows us to kind of peel away those layers of the onion and get down to the root of what the issue is, whether it's inside, outside, upside down, wherever it happens to be.
Some of my favorite conditions to work with are people with headaches. When you have a headache, you're suffering all the time, and we see it from people who have, you might be one of those people who get a migraine every day of the week, and you've been told that it's your normal headache, or you've just accepted now that it's your normal headache. No headache is normal. I also love working with a patient who has chronic fatigue, bowel discomfort, whether it's gassy, burpy, belchy, bloaty, loose stools, constipation, heartburn, indigestion. Those all respond very well to both chiropractic and the functional medicine side.
Good to see someone go from, oh, this is never going to go away, to, oh my gosh, I don't have any pain right now, or oh my gosh, this is so much better than it's felt in 6 months or a year or whatever. That's what makes your day.
Inevitably, life's going to throw you curveballs, whether you exercise too hard or have a sprain, strain, or just want to recover faster from a great workout. That's really where we want to get our patients to, and not be coming in for the same thing over and over and over again.
Life's going to throw you curveballs. Things are going to happen. Our goal is to empower you to have the tools to be able to work those things out on your own, or have the resource to check in with us when you need us.